We're now going to demonstrate to you a hip abduction in side lying. The abductors are the muscles across the outer hip. The aim of this exercise is to strengthen these muscles across the hip. This can help in conditions such as arthritis of the hip, mechanical lower back pain, general soft tissue injuries of the lower limb. You may be given this exercise following hip and knee surgery. Now, weakness to these outer hip muscles can increase the stresses and strains being placed on the hip, back and knee. This can ultimately lead to pain. You may find it difficult then to perform simple activities such as walking correctly, going up and down stairs, and even standing from a seated position. It's really important that we strengthen this area because stronger muscles are more effective in protecting the hip joint and the soft tissues around it. But the key to this exercise is technique, and that's what we're going to show you now with the demonstration. So Pete, lying on your side in perfect alignment with your hip, knee and ankle in the correct alignment. Okay, it's important that you're on a stable surface like a bed or the floor. What I'd like you to do, Pete, is slowly lift your top leg up to its maximum point, keeping it in alignment with the lower leg. Hold for 5 seconds and then lower back down slowly. Keeping it controlled and bringing it down directly on top of the lower leg. Now you should feel this work in the outer hip muscles. Is that right, Pete? Good, it's really important that you feel it working around this area, because one of the major faults is not being able to control your back and your pelvis when you're lifting your leg. So the first fault is actually hitching your hip up too much. So Pete's going to demonstrate that now. You can see he's squeezing in into this area, and that is actually because he's overusing his back muscles. This can be down to a weakness around the gluteal muscle or just poor technique. One way to correct this technique is to place your hand at the top of your pelvis. So Pete, if you can put your hand there, this is going to be a guide for him to prevent him from hitching the hip up. Can you feel that gives you a bit more feedback, Pete? Good. The second major fault is actually rolling your hip back and bringing your leg forward in this way. Now this can be due to a few reasons. It can be due to tightness at the front of the hip, or again, weakness in the gluteal muscle, or just poor technique. So it's really important, Pete, that you try and keep that leg directly aligned over the other leg, okay, and don't let it drift forward. If you're unable to correct this technique with these tips, then it's really important that you consult your physiotherapist. We recommend that you gradually build up to 30 repetitions, holding for 5 seconds each time. It's important to take regular breaks when you feel you need to. Alternatively, listen to the instructions given to you by your physiotherapist. Now Pete, it's normal to feel muscle ache down this area of your outer thigh, but what we don't want is to increase your pain by greater than 2 out of 10, with 0 being no pain and 10 being the worst pain imaginable.